Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Pediatric Assessment, Episode 2, Assessing the Toddler. After viewing this episode, participants will review the physical and developmental characteristics of a toddler. Participants will also review the barriers that influence the assessment of a toddler and how to reduce them. Finally, participants will review the normal and abnormal physical findings, vital signs, and weights of a toddler.
Toddlers are such the widest range of ages. They have the most development during these times of like 1 to 5 years of age. They are becoming verbal, yet a lot of times on the lower end, the 1, 2, 3-year-olds, they cannot put sentences together yet. They cannot formulate complete thoughts. So a lot of times they're saying single word sentences to be able to try to communicate them. That along with size. Now size can be very, again, wide range. You can have tiny 4-year-olds, you can have big 2-year-olds. So the age range and size is not as good as assessment as really their interactiveness with you.
Toddlers are a little bit easier than infants. I think infants tend to scare providers because you also have the family hovering over you. So toddler's a little bit bigger, so it seems a little bit easier. However, the toddler knows what's going on, and those are the kids that really are screaming, clinging to the parents because they see all this equipment, they see people that they don't know, so that makes them much more afraid.
Toddlers are on their way to having a normal physiologic state, much more similar to an adult versus what they experience in infancy. Their head size is starting to become proportionate to their body, so you usually will not run into the airway troubles that you would have seen in an infant. They're much better at maintaining their temperature, but yet they will still have the increased heart rate, perhaps an increased respiratory rate, more similar to what you would see in an infant. But you'll start to see their head size come into line with the rest of their body. Toddlers start to develop a more musculature, a better bony structure. However, their internal organs are still relatively large compared to the rest of their body. So things like motor vehicle accidents can cause a disproportionate amount of internal organ damage than you would expect in somebody larger like a teenager or an adult.
Toddlers range from 1 to 5 years of age. Of all the age groups, toddlers experience the greatest developmental changes. This includes more muscle and bone structure and a physiology closer to an adult than an infant. A toddler's head size is more proportionate to their body, however, organs are proportionally larger than the body. A toddler is able to maintain body temperature better than an infant.
The development of a toddler can be a tricky thing. You're very likely to find a very social, happy toddler that does what we call confabulate, and that's usually a 3 to 4-year-old who likes to tell all sorts of stories, is eager to please, and will tell you anything you want. But you can also find a 2 or 3-year-old who has a lot of stranger anxiety and doesn't want to participate. So you really don't know what you're going to get when it comes to toddlers, but engaging the parents usually will help, and parents do know their child best, and they're often able to explain to the child that it's a safe situation. When you're dealing with somebody who's sick or injured, their anxiety level, of course, is going to go up. So approaching them with a toy. Most toddlers or young children like to wear something that's their favorite thing, or wear a favorite color, or they may be like Spider-Man or Dora the Explorer. They usually have something on them that's a clue as to what they like. And so I suggest taking note of what that is.
Again, some of the common barriers I believe is anxiety for a toddler. They're afraid. Most EMS personnel do allow families to come, but if you can't have a family and a child is backboarded and collared, it's very scary to them. And each child is a little bit different, but the toddlers don't understand. They see a little bit of blood, they think that maybe they're going to lose their finger, so they just need a lot of reassurance, a lot of support, and communicating to their level where they understand. And it's very easy to forget that you're talking to a toddler and know that they hear everything that is, when if you're having a conversation with other staff, that they hear it. So just being aware of how you speak to them.
Common barriers, very much, this is the age group that starts with the stranger danger. So they tend to, if they're interactive with you and you start coming towards them, they very much start having their red flags raise up because they're taught that you're not their caregiver. They become very clingy to their caregiver. They make it very hard to assess them. I think also too, this age group, more than anything, their cry really tends to raise everybody else's kind of elevation of adrenaline. It makes everybody else kind of a little nervous. So remembering that that's normal, and if they really are crying for their caregiver, that's a really good sign to do, and to have. Also, that these are risk takers. This is the group that they're risk takers. They're not afraid to jump off the couch. They're not afraid of doing any of the trauma stuff. They're not afraid of putting things in their mouth. So I think sometimes we forget as EMS providers that your assessment has to go a little bit deeper than just a visual, well, they look okay. You really have to do some good lung sounds, and you really have to remember that you have to look at their vital signs and really look at their appearance and their work of breathing to make a good assessment.
Toddlers can interact in many different ways. They can be eager to please, they can confabulate or tell stories, or they can have increased levels of anxiety with strangers. Incorporate the parents in assessment. Identify objects the toddler can identify with, such as a toy or a cartoon character. Reassure the toddler that you are there to help, to overcome barriers.
Best assessing toddlers is done usually on the parent's lap if the situation would allow, and involving the parents as much as possible. I suggest often doing part of the exam to the parents first, having the parents verbalize that this does not hurt, and then moving along. I usually start very slowly with things I know are not going to hurt. For example, using my stethoscope, listening to their heart, listening to their lungs, looking in their mouth, and then moving on to things like pushing on their belly that might be a little uncomfortable, even if the child was feeling well. Take it very, very slowly, move at the child's pace. Usually we all have our own routine that we like to follow to make sure that we don't miss anything, but when you're dealing with a toddler, you often have to follow whatever that toddler's routine is going to be. Again, if you have a screaming, crying child, that's going to skew your exam, and you want to have them in the most comfortable position possible.
Some important aspects with the toddler, I guess, depends on what the presenting complaint is. And I would say for EMS and what I do nursing for triage is, again, go back to your ABCs. Whether you're dealing with a respiratory issue or trauma, it's going back to how do they look to you, how are they presenting, is the child talking, is their airway clear, are they breathing okay, is their color okay?
So when EMS providers need to assess toddlers, they need to include the caregivers, but they also have to be on high alert for signs of abuse. This is the group, because they're not verbal, they're not well versed and able to put thoughts together in putting full sentences together. This is a group that kind of where you might see some signs of abuse, as well as be on high alert for trauma. This is the one that you really have to protect them from themselves. Car seats, making sure that they're properly in their car seats, and if they're properly belted in their car seats if you go to any motor vehicle accidents, but really remembering that you have to assess their appearance, their work of breathing, and their skin color is going to give you a lot of tips on how they're doing. Again, with toddlers, really their appearance is huge. So if they are not interactive with you, if they don't acknowledge you when you walk into a room, if they don't look at an EMS provider as they're starting an assessment, that's concerning. If they're kind of listless, if they don't even acknowledge you when you start to even touch them, is very, very concerning. Increased work of breathing or decreased work of breathing, so how are they breathing, is very concerning with when you want to assess a toddler, and making sure that you're looking at their chest rise, are they belly breathing, that will tell you a lot. And then skin color, again, skin color with kids, if they're pale, that tells a lot, they're sick. The circulation definitely would need to be addressed.
Try to assess the toddler where they're more comfortable. Start with components of the assessment that do not hurt to build confidence with the toddler. Stick with the ABCs, airway, breathing, and circulation to guide assessment. Appearance and interaction by the toddler is an important clinical characteristic in identifying illness and injury.
Normal vital signs and weights for a toddler, again, can vary quite a bit. Obesity has certainly become a problem in the United States, and we're starting to see many heavier young children, even in the toddler age group. So you can have a toddler anywhere from 10 to 25 kilos would not be abnormal at all. Heart rates, blood pressures, respiratory rates will start to come into more of the adult range, where you see heart rates can vary anywhere, again, from 70 to 140. Respiratory rates can be in the teens up into the 30s. again, this is a population that you really need to look at the whole picture. One abnormal vital sign does not necessarily mean there's a problem, but an abnormal vital sign with an abnormal exam is what you would need to see.
Weights and vitals can vary in the toddler. Heart rates can range from 70 to 140 beats per minute. Respiratory rates can range from 24 to 40 breaths per minute, and weights can range from about 10 kilograms at 1 year to approximately 22 kilograms at 5 years. After viewing this episode, participants will review the physical and developmental characteristics of a toddler. Participants will also review the barriers that influence the assessment of a toddler and how to reduce them. Finally, participants will review the normal and abnormal physical findings, vital signs, and weights of a toddler.